There's been a slight drop in infection rates across most provinces except in the Western Cape and KwaZulu-Natal. But the country is not out of the woods yet. Government remains on alert for a possible resurgence in provinces where infections have dropped.
We are still very much in the third wave. I should emphasize the point that we haven't had a significant reduction in numbers yet, but nevertheless we remained planned for the fourth wave in provinces, particularly where the numbers have declined significantly. The IMT, which is a structure that at a national level monitors the response to the COVID numbers, and at a provincial level we have a similar structure. So we look at on a daily basis the number of cases, the number of hospitalization, the oxygen requirements, the PPE requirements, the medicine availability, the bed status, the additional beds that need to be put in place, etc. We use the modeling team that then predicts for us what we anticipate as the additional beds that will be required in order for us to be able to deal with a particular wave. So that's an ongoing exercise that we continue to do even during a wave and before a wave.
The health department says the fourth wave could be averted if people adhere to social distancing and ensure that they vaccinate.
The predicted fourth wave, I have to say, is related largely to what is anticipated to be human behavior, particularly at the festive season, where people forget about COVID and decide to socialize and spread the infection. So I think it's really important that we recall what happened last year in 2020, where we had a huge second wave, largely because people did not adhere to the non-pharmaceutical interventions, and that led to quite a large wave, second wave. We can prevent that this year, and by simply adhering to all of the measures that are in place in order for us to protect ourselves against the infection.
Here are the do's and don'ts for the 18-year-olds now eligible for vaccination.
To just address the point of do's and don'ts, I mean, we do know that having a vaccine can give you a day or two of slightly achy body and a heavy head or sore throat. So I would say to take it easy the day that you're doing it. Don't go run a marathon on the day you're having a vaccine. Go there when you're healthy, do the vaccine. And if you've been exposed to someone with a proper exposure in the last few days before the vaccine, you should probably delay your vaccine a bit in case you are getting COVID. And once you've been vaccinated, you should use paracetamol as a good simple drug for treating the side effects, and have patience. It's normal to get a bit of redness around the sites of vaccination, inflammation there, which will go down. And really only if the side effects last beyond a few days, then contact a healthcare professional and it will be registered and looked into as an adverse effect.
Over 4.6 million people are now fully vaccinated in the country.
When we did get Johnson & Johnson vaccine, it was 1.5 million doses. They were short expiry doses, which were only a few weeks. At that stage, it was not going to be guaranteed that we would be able to get further Johnson & Johnson vaccine. And we didn't know how long it would take to get the global supply and our own supply running again. So we needed to use the Johnson & Johnson at our disposal in a controlled environment where we did not re-engineer and disrupt all of the sites in the rural areas once more, without any guarantee that we would get a continuous supply that would pick up immediately after the end of the short expiry doses. So it was then decided that we would wait until we restored the normal flow, a constant flow of Johnson & Johnson vaccine. And as you've heard, that has not even happened yet. We do have some Johnson & Johnson vaccine, but globally, they are only gearing up on their production and distribution at the moment.
Due to limited doses, the Johnson & Johnson vaccine will be prioritized for rural communities, the homeless, and the frail in urban areas. The department expressed concern following an 18.5% increase in new infections in the past week, appealing for anti-vaxxers not to spread their uninformed opinions and discouraging would-be vaxxers. Ofentse, Setimo, SABC News, Pretoria.